Good morning. I'm Dr. Sasikala, Professor and Coordinator of NHHID, Anna University. It gives me immense pleasure to extend a warm welcome to all the students, faculties, and other participants for the awareness and training program on hearing, prevention, and management, which is jointly organized by the National Hub for Healthcare Instrumentation Development, Anna University, and Madras Ent Research Foundation, Institute of Speech and Hearing. I wish to share a few words about NHHID. The National Hub for Healthcare Instrumentation and Development is established by DST in Anna University, which is a national facility and first of its kind in the country. It promotes and accelerates the development of indigenous healthcare devices. We have created state-of-art facilities and also a very good ecosystem to promote development of prototypes, translation of prototypes into products, clinical validation, technology transfer, and commercialization. For more information about NHHID, you can visit our website. Coming to today's program, the World Hearing Day is observed on March 3rd every year. So the theme for this year is to hear for life, listen with care. So this focuses on the importance of hearing loss prevention through safe listening. So the aim of today's program is to create awareness about the hearing loss prevention. So with these few words, may I now request Professor Ranjit, Principal and Director, Chief Audiologist, to deliver the session. Thank you.
Very good morning to everyone. First of all, I would like to thank everyone for joining this program on awareness and training for hearing prevention and management. Myself, Ranjit Rajeshwaran, I'm the director and the principal of Merf-Institute of Speech and Hearing in Chennai. Basically, I'm an audiologist and speech language pathologist working in the field of hearing health care for the last 25 years in identifying, preventing, and restoring hearing loss across lifespan, right from children who are born and up to the age of geriatric people. Now, for this, I would like to, for this program, I would like to thank the collaborators, which is Merf Institute of Speech and Hearing in Chennai, Madras Ent Research Foundation, National Hub for Healthcare Instrumentation Development at Anna University, and also our collaborator, World Health Organization. Today is a very important day where we are going to deal with one of the most important sensory system in the body, which is hearing. Hearing is one of the most sophisticated sense. Yet it is the only sense that can be restored even lost completely, which means even if someone has a hearing loss of more than 100 decibels, or put it in a very simple term, if they have a hearing loss of nearly 100%, we can restore hearing to near normal level, which, which is not possible if you lose any other sense. Now, what is hearing? Hearing is a sensory system which actually codes all the acoustic informations in the air. Whatever is the sound, it codes informations as electrical signals and send this information to the brain. So, which is very, very important for us to understand the environmental activities, so which help us to bond with the environment, connect with people, communicate with people, and also to express our thoughts and intentions to others. And hearing is one of the important sensory system which helps us to gain knowledge through education. Now, how does this ear function? Here is a very sophisticated structure. Now, basically, it has got three important systems. One is the external ear, the other one is the middle ear, and also the inner ear. Now, the function of the external ear is to collect sounds. If you see this video, you can see this, it collects sounds. The middle ear transmits the sound to the inner ear. In the inner ear, what happens is the sound is converted into electrical signals, and these electrical signals are transmitted to the brain through this auditory nerve over here. Now, brain will interpret the sound. Now, this is how the ear functions, which means any damage to the eardrum, this is called the eardrum. What you see here is the eardrum. Any damage to the eardrum, or any damage to bones in the middle ear, or any damage to the inner ear structures will cause hearing loss. Now, this can cause different types of hearing loss, different degrees of hearing loss. Now, there are several degrees. Now, when do we call a normal hearing? Normal hearing is when your hearing thresholds are less than 20 decibels. Now, what do you mean by threshold? Threshold is a minimum level that you can hear a sound of a particular frequency. Now, what is frequency? Frequency is nothing but number of vibrations or number of cycles per second. Now, there are different frequencies. I mean, the most important frequencies for hearing range from 100 to 8,000 or 8,500. Now, usually the hearing test is done on octaves of 125, 250, 500, 1000, 2000, 4000, and 8000 hertz, which means most of the sounds that we listen in the environment falls within this frequency range. Most of the sounds that we use for understanding falls within this frequency range. Now, we can test the hearing sensitivity at different frequencies and see what is the level of hearing for an individual. A normal hearing means hearing level less than 20 decibels or 25 decibels is normal. So, if the hearing level goes beyond 25 dB, depending on the level of hearing, they are categorized as mild, moderate, severe, and profound hearing loss. So, this is called the degree of hearing loss. There's something else which is called the type of hearing loss. Type of hearing loss is nothing but where exactly the problem. For example, in the previous slide, as I told you, this is the middle ear. If there is a problem in the middle ear, this causes conductive hearing loss. If there is a problem in the inner ear, this causes sensory neural hearing loss. If there is a problem in both middle ear and the inner ear, it causes mixed hearing loss. And that's what is being explained here as conductive, mixed, and sensory neural. Now, there are several causes which can cause a conductive hearing loss, sensory neural hearing loss, or a mixed hearing loss. Now, hearing loss due to aging, or noise damage, or side effects due to intake of drugs, or hearing loss due to tumors in the auditory nerve or within the cochlea, or if there is a hearing loss due to explosion or a blast injury, what we call it as. This causes sensory neural hearing loss. Now, if there is a problem in the middle ear cavity is usually filled with air. In case because of infection, if it is filled with fluid, if there is a foreign body in the external ear, or allergies, rupture of the eardrum and the wax, impacted wax, all these things can cause a conductive hearing loss. Now, mixed hearing loss could be a combination of both. Usually, some of the genetic disorders can cause mixed hearing loss. Infections can cause mixed hearing loss. If there is a trauma, road traffic accident can also cause a mixed hearing loss. However, the mixed hearing loss is a combination of both sensory neural and the conductive hearing loss. Now, what are the consequences of hearing loss? So, we know that the hearing loss has got different consequences. Now, the first and the foremost thing is your cognitive impairment. If you have a hearing loss, it is very difficult for you to develop your cognitive skills, which impairs your process of thinking and execution. Almost 29 to 57% of the people are at high risk of cognitive impairment because of hearing loss. Another important problem is dementia. Dementia is loss of memory. If you have a hearing loss, there is a high possibility that you can lose memory. So, in case if you think that your memory is going down, that could be because of hearing loss as well, which you may not notice. And any degree of hearing loss can also cause dementia, and especially when the hearing loss is very severe, the dementia, the incidence of dementia or the risk of dementia increases by 5 times more. Another important problem could be due to, uh, uh, as I told you, it can impair your memory when the hearing loss is untreated for a longer period. Another problem is conversation. So, conversation is very important, which we do every day from between your friends or your family members. Now, when you have a hearing loss, the conversation is impaired, and because of which you will never enjoy conversing with people, which will lead you to social isolation. So, you will isolate yourself. And another important problem because of isolation is your social life will suffer. So almost 20 to 24% of the people are less likely to participate in social activities just because of hearing loss, because they cannot converse with their friends and family. Another important problem that people face with hearing loss is anxious and insecure. They always feel insecure because of this hearing loss. They will never feel confidence. The level of confidence goes down. There is a level of insecurity goes up. Now, another bigger problem is feeling exhausted. Because you have a hearing loss, your listening is affected. Because you are not able to listen, especially when you have to listen to your meeting, your friends who's delivering lectures in the meeting, when you listen to your school teachers or professors who's delivering lectures, you will have a problem in listening. Your attention span will go down. When your attention span goes down, you need to focus more on listening. When you focus more on listening, your brain gets tired so fast, what we call it as a mental fatigue. And because of this mental fatigue, you will not be able to sustain your attention beyond 10 minutes or 15 minutes. To put it very simple, if you have a problem in listening, sustaining your listening in your class when a teacher is teaching, that could be because of some kind of hearing disorder as well, which you may not even realize at a very early stage. And at the end of the day, because of all these things, your potential ability to earn, to become a very productive citizen goes down. So obviously, you become dependent on people rather than you becoming an independent professional who will be able to lead your life independently. Now, the communication, cognition, education, social emotion, and economic, everything goes down when you have a hearing loss. That is why the hearing loss always has a cascading effect. And most importantly, hearing loss is a kind of a problem which does not evoke any sympathy, unlike other disorders. Now, WHO has clearly given projections that is based on the data which is collected worldwide. They've predicted today almost 401 million people in Southeast Asian countries have hearing loss. But in another 20 years down the line, this is expected to increase almost two times. 666 million people may have hearing loss. So if you look at the data here in different regions across the world, now every region, there is a high potential of increase in hearing loss. Now, if you look at the Southeast Asia, this is the place that where we all come from, this area. Now, what's happening here is the highest incidence of hearing loss is found in Southeast Asian region, and it is expected to be double by 2050. And this is something of very high concern. In future, what's going to happen is almost one out of every 5 person on the road will have some form of hearing loss. And I would like to draw your attention on a very important thing here. Now, what's happening is if the hearing loss is very expensive, it is not easy to restore hearing, and it is not easy to maintain hearing once you lost hearing. It is very expensive. And the US alone spends close to $108 billion every year for treating this kind of disorders, hearing disorders especially. So it is very important for us to invest on this particular disorder. So every dollar that we invest today is going to earn us $6 later. So which means please pay attention and take care of your hearing. That's exactly what we are trying to do. And this particular information that I'm trying to tell here is for the public policy makers, that we need to really focus on hearing disorder, which is going to cause huge economical drain in the future for the society as well as to the governments. Now, again, looking at the statistics, now if you look at it, the prevalence of hearing loss is increasing over a period of time, and it is expected to reach almost the double in 2050. And this is across all countries, all regions here. So today we have a hearing loss, which is close to 1.5 billion people are infected with hearing. And by 2050, it is expected to be 2.5 billion. This is based on the current data which is available from the WHO. But this 2.5 billion, in my own opinion, is a very small figure. If we really don't take care, this 2.5 billion may even increase up to 3 billion or 3.5 billion in by 2050. Now, what are the signs of hearing loss? Now, how do I know that I have a hearing loss, and what are the symptoms and signs of that? Number one is misunderstanding people. You will not be able to understand conversations. You will be able to hear sounds. You will be able to hear their speech, but you will never be able to understand, or you will have difficulty in understanding the conversation. For example, out of 10 words, you may understand 5 words. Remaining 5 words, you may have to guess based on the context and the situations. And naturally, when people have a hearing loss, they always tend to increase the volume. Either they listen to the televisions or when they're listening to the music system. Now, especially the hearing loss starts at high frequencies. When there is a problem in the high frequency, they will have a problem in perceiving the high pitch sounds. They won't have a problem in perceiving low pitch sounds, which means, for example, when I say a word sun, in this word sun, the sound sa is a high frequency, which is high pitch. A is a low pitch. So when you say sun, they will only hear un. They will not hear the s sound. So this is a kind of one of the very classical signs that usually people with hearing loss exhibit. Now, and they always ask people to repeat because they won't be able to understand properly. They'll always ask for repetitions, and they will have a severe problem in understanding speech in a noisy environment. There are two types of environment. Environment is a quiet environment where there is not much of noise. It is very easy for you to understand speech or conversations. But when the environmental noise level goes up by 10 dB or even 20 dB or even 5 dB, they will have severe problem in understanding speech, understanding conversations. So this is one of the classical signs of hearing loss. So when you have a problem in understanding speech in a little noisy environment, that means you're you have some kind of hearing loss, whether it could be mild or moderate or severe, whatever it is. And then they also tend to speak very loudly. People with hearing loss will always speak louder. And they have other symptoms of ringing noise in these ears. So there will always be a constant noise in the ear. The type of ringing noise may vary. It could be constant or it could be intermittent, but they will have some kind of ringing noise. So whenever you have a ringing noise in your ear, the first thing that you need to do is to go and check your hearing. And they'll have difficulty on conversing on telephones. So basically, point number one is they will have problem in hearing. The point number two, they'll have severe problem in listening. The point number three, they will have the profound problem in listening in a noisy environment. So because of which they will add some coping mechanisms like asking for repetitions, speaking louder, increasing the volumes in the televisions or the music systems. So these are some of the signs of that people exhibit when they have a hearing loss of different degrees. Now, how to prevent hearing loss? Very important thing. Now, one of the most important thing is the fundamental things is do not put anything in the ear. No cotton, no buds, clips, toothpicks, sticks, or hoppy candles to remove wax. In case if you have a itching sensation or if you have there is a wax that is blocking, you need to go to an ENT doctor or a physician who will help you to remove this wax. Now, another thing, do not ignore an ear that has any pus or fluid coming out of it. Most often, you will see when you have a middle ear infection or somebody with a upper respiratory tract infection who catches cold quite often, they may tend to have a ear problem. Initially, it starts with the blocking sensation, and later there may be a fluid which forms in the middle ear may leak through the tympanic membrane, creating a small perforation. Whenever you have a watery discharge or a pus that's coming out of the ear, you should never ignore it. You should go to a doctor and treat it immediately. Do not treat any ear conditions with hot or cold oil or herbal or homemade remedies because this can damage. And most important, don't swim or wash in a dirty water because this can potentially cause hearing damage. It can have infections in your external ear. And don't listen to very loud noises or music for a long period, as this can cause hearing loss. This is very important, which I want to draw your attention. Now, the reason is this is something which is quite a common cause of hearing loss in youngsters. So, what is important is how to avoid it is keep the noise volumes down, protecting your ears in a noisy situation. That means when you go to an environment where it is very noisy, which is out of your control to reduce it, always use a cotton or an ear plug to protect your ear from very loud noises. And whenever you're listening to some music, whenever you're listening to watching televisions, keep the volume down. That's what we call as monitoring personal sound exposure. So when you listen to iPads, iPhones, or you use the MP3 players to listen to music, always keep it at a very low level. Now, Another important thing is minimizing the time spent in noisy environment. So when you go to a noisy environment, which you can't avoid it, reduce the duration of time that you spend there. So try and escape as quick as possible so that you move to an environment which is less noisy and which is more safer for your ears as well. Now, another important thing is the autotoxicity. What is autotoxicity? Autotoxicity is nothing but the toxic substance that can affect ear, which is the drugs which has an effect or poisoning the ear function. So there are some drugs which are autotoxic, which means when you consume those drugs that can impact your hearing. So what is more important is whenever you go to a doctor, you may have to check with them whether the drug is autotoxic or non-autotoxic. So these are some of the commonest causes, and this is the way one of the common solutions to uh, prevent your hearing loss. Now, as I told you, the commonest cause of hearing loss is noise, and especially in today's lifestyle, noise is one of the predominant cause of hearing loss, especially in youngsters. So, some of the simple tips to avoid hearing loss or prevent hearing loss is to keep noise volumes down, avoid noisy environments, use ear protective devices, and reduce the volume in your music system or personal music system or televisions. Now, the next most important thing is we should also know what are the safety listening standards, which is very important. I've been talking about you need to be safe, you need to reduce the volume level, but what is the level at which my hearing is protected, a level at which my hearing will not be damaged? Now, we have to consider three important factors. Number one is the loudness, which is what we call it as the level of hearing. The second one, what we need to consider is the duration, the time that you spend with loud sound or loud music or noisy environment. The third one is how frequently you get exposure to these kind of things. These are most important things that we need to consider. Now, considering all these things, the very simple way to reduce the noise induced hearing loss or prevent your hearing uh, due to noise induced damages is to always listen to intensities below 80 decibels for a maximum of 40 hours of duration in a week. Now, what does it mean? It means, in a very simple term, when you are listening to a music using your headphones in a very quiet environment, you should always make sure the person who is sitting next to you, shouldn't hear what you're listening to. So you should always keep your volume level lower or higher, that the person who's sitting next to you does not hear what you're listening to. So whenever you use the very good uh, system, that is, for example, when you use an iPhone or any other phones, when you listen to music, they always give you a safety warning. So never exceed the safety warnings. You always go below the safety warning. If you use a gadget where you don't have the safety warning options, which means you use it at a very comfortable level where the person sitting next to you does not hear what you're listening. I'm talking about an environment which is very quiet. In a noisy environment, it is very difficult because you may have to increase your volume. Most often, what happens, the students always listen to music when they're driving scooters, when they're driving cars, when they're traveling in a public transport like train or bus, where the environmental noise is quite high. Because the environmental noise is quite high, we usually tend to increase the intensity of the your headphones at a very louder level. And then you really don't care about it, because as long as you hear the songs at your comfortable level, you're fine. But actually, what you're doing is you're increasing your intensity level quite high. This is quite common, and this will definitely damage your hearing. And what does it cause? It causes something called a temporary threshold shift, which means that is a early damage. That is a sign where your hearing sensitivity decreases because of exposure to loud sounds for a very brief period. But when you keep continuously listening to loud sounds for a very longer time or a frequent duration, this temporary threshold shift will become a permanent threshold shift, and this is what is called a hearing loss. The threshold of hearing will shift permanently, which will cause a irreversible loss, which means you cannot reverse this back to normal. So keep in mind, whenever you are traveling in a public transport, or when you are when you are listening in a noisy environment, always keep your listening levels at a comfortable lower level, which is less than 80 dB. Or you use a high quality headphones and noise cancellation headphones, which can cancel the environmental noise so that you can listen to sounds at a very lower level, which does not cause much damage to your ears. Now, this is exactly what I told you earlier. In order to stay within this level, it is important to keep volume as low as possible while listening to music. Limit the time engaged in noisy activities, including activities at work, home, and leisure. Monitor safe listening levels over a personal audio system and in a noisy spaces. Now, always heed the warning signs of a hearing loss. That's very important. So, if you look at the this one, this is something that warning sign or warning pop-ups that you get when you use your music system. So, whenever you see these pop-ups, always understand that you're exceeding the volume level, which may cause damage to your hearing. Please respect these pop-ups and then keep your volume levels lower so that your ear is not damaged. Now, hearing across lifespan. So, what is more important is we all need to hear throughout our life. At any point of time, when there is a problem, as I told you in my earlier slides, the consequences are going to be very severe. Now, hearing needs to be protected throughout life, and for which the one which is being projected above are the causative factors of hearing loss. There could be genetic factor, that could be work-related stress, autotoxicity, smoking, exposure to loud noises, and malnutritions, traumas. Everything can cause hearing loss. So we need to have a very healthy lifestyle, and most importantly, listen to very soft and loud, not very loud sounds. Listen to very soft sounds to protect your hearing. Now, another important point is age-related hearing loss. Now, this is quite common. People usually refer to hearing losses, which can acquire as a process of aging. So, as far as I know, the average age at which we have presbyacusis, the hearing loss due to aging, happens around 60 years of age. But nowadays, what is happening? This is accelerated, which means the presbyacusis happens at a very younger age. From the age of 90, nowadays it starts even at the age of 20. The noise induced uh, hearing loss is one of the commonest factor. Now, what does it mean? It means because of constant exposure to loud noises, the age at which you acquire hearing loss goes down. Instead of 60, it even goes down to 20. So, noise is one of the major factor. Apart from the noise, the lifestyle is also a contributing factor for presbyacusis, that is hearing loss due to aging, which means that everybody who's at the age of 20 now are at a high risk of developing a hearing loss if they don't take care of their lifestyle, if they don't monitor the noise level that they are listening to. They are highly at risk of developing a hearing loss by the age of 25 or 30. Now, what is noise induced hearing loss? I've been talking about noise induced hearing loss. How do I know which noise is dangerous, which noise is safe in a day to day environment? If you look at this, now the road traffic causes close to 80 dB of noise. Now, when you're exposed to a noise of 80 dB for a period of 8 hours, for almost more than 40 hours or 60 hours per week, there is a possibility of developing a hearing loss, which may turn into a permanent hearing loss in the future. In a nightclub, the noise level is 100 decibels. The road breakers or a rock concert, the noise level is 120. This is what we call a threshold of pain. The jet engine takes off noise is 140. The gunfire is close to 140. The rocket launch takeoff noise is close to 160 decibels. Now, the safety level is less than 80. If you cross 80 and above, you are at high risk of hearing loss at a very younger age, which means you will have a problem in communicating with people. and you will also have cognitive decline and memory loss. Now, how do I get my hearing tested? Now, hearing can be tested very easily. There are a lot of centers for hearing testing in and around your place. The way we test hearing may differ from babies, children, and adults. In babies, we do a hearing screening, which is a quick and fastest way of screening. And this hearing screening can be done as young as 1 day old, which means even if the child is born within 1 hour of the child's birth, it is possible to do hearing screening. This is called the newborn hearing screening, which is quite commonly done nowadays. Now, for a children who has got a risk of hearing loss, the hearing evaluation can be done using different procedures, objective procedures, what we call it as a ABR test or auditory brainstem response test. We can assess hearing for these children. And for adults, we can use a simple test or what we call it as a pure tone audiometry. PTA is nothing but it's the pure tone audiometry. Where do I go for hearing test? Who are the professionals involved in testing hearing? So, who are the professionals involved in hearing testing? Now, audiologists are the most important professionals. Those are qualified for identifying, diagnosing, treating, and managing all kinds of hearing and communication disorders. Now, these are very important professionals. And their role, as I told you, is to identify, diagnose hearing loss, recommend appropriate amplification in case if there is a hearing loss. They are the professionals, those are qualified to recommend what is the kind of hearing aid to be used for them. And they are also important in counseling on managing hearing loss and preventing hearing loss. The other important professional, most important professional, is an ENT doctor. The ENT doctor is the one who diagnoses and treat ear infections, and he also provides medical management in case if there is a damage to the ear caused by any of the factors. Now, as I told you before, this audiologists and speech language pathologists are very important professionals when it comes to hearing and hearing restoration. And these are professionals, those who work very closely with ENT surgeons, pediatricians, neonatologists, psychologists, neurologists, and neurosurgeons. Because working with these professionals will help both the professionals to complement each other in identifying, diagnosing, and treating and restoring hearing and communication disorders. Now, this is a very important profession where these people are trained for a minimum degree of 4 years with a master's degree of 2 years. So, totally, they study 6 years in their graduation and post graduation about the science of hearing, the diagnosing hearing problem, managing hearing problem, and restoring hearing problem. Finally, the most important thing that I want to highlight here is today there are almost 1.1 billion young people are at risk of hearing loss due to unsafe listening. This is the point what I want to highlight, which means 49 million people aged between 12 to 35 years live with a disabling hearing loss. And this is expected to increase, which means 1 out of every 2 young people listen to unsafe level of sound through personal audio devices such as smartphones, MP3 players, and others, which means 40% are exposed to potentially damaging levels of sound in entertainment venues such as nightclubs, bars, and sporting arenas. Now, which means almost 40% of younger population between the age of 18 to 25 are at risk of developing hearing loss before the age of 25 or 30. So this is catastrophic, which will definitely impair their lifestyle, their social being, their potential to improve the quality of life and the society. So this is why we wanted to have this particular meeting today and this seminar today to create an awareness among young adults that be careful that you're all at a risk of hearing loss, which means 1 out of every 2 person are at a risk of hearing loss in another 5 years' time, unless and otherwise you take precautionary measures as explained in the previous videos and previous slides. Now, you can also access us through emails. Uh, we will be providing you the contact email where in case if you have any queries, any clarifications, or if you feel that you have a hearing loss, or you feel that you tend to have a hearing loss, you can contact us. We'll be happy to support you, counsel you, put you onto the right people, give right directions to make sure we protect and conserve your hearing as quick as possible for you to lead a healthy hearing life throughout your lifespan. I wanted to make an important announcement that following this lecture, there will be a link that will be provided to you. You have to click that link and you will have to fill out a questionnaire. And this questionnaire has two components. One, which will help you to understand about hearing and hearing disorders. The second thing is a hearing checklist. So there is a checklist which you can fill it up, which will help you to understand whether you are at risk of hearing loss or not. This is a standard checklist which has been adopted from the American Speech and Hearing Association, which you can use it to monitor yourself whether you're at risk of hearing or not. And in case if you feel that you have a problem, you can always reach us in the following email and the contact address. Once again, I'd like to thank everybody and all the stakeholders and the WHO for this opportunity to talk to all of you. Thank you very much, and safe listening and safe hearing. Thank you.
Thank you all for listening the lecture. I hope the session was fruitful. I thank Professor Ranjit for this wonderful talk. On behalf of NHHID, I thank our Honorable Vice Chancellor, Dr. R. Belraj sir, and our respected Registrar, Dr. G. Ravikumar sir, for giving this opportunity to conduct this program. I thank all the faculties of EMRC, RCC, and all other faculties for supporting us to conduct this program. I thank all the participants for attending the program. Kindly complete the screening test which is provided in the description, and e-participation certificates will be provided to all those participants who submits the screening test. If there are any queries, you can text it in the comment box. I once again thank all the participants for attending this program. Thank you.